Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 545 of our pharmacotherapy series, which majors in bipolar disorder. This part of the series involves patient CNN from part 544 of this pharmacotherapy series. After 3 weeks of lithium therapy, CNN is demonstrating significant improvement in her sleep, impulsivity, delusions, and activity level. She has achieved a lithium carbonate dose of 1,200 mg per day, and her lithium level is 0.8 milli equivalent per liter. Today she is complaining to the clinical staff that she has developed a hand tremor. Soon after her clinician arrives to evaluate her, CNN asks to be excused so that she can go to the bathroom. How might CNN's presentation be related to her medication? When considering adverse effect management early in lithium therapy, it becomes important to monitor lithium levels closely. When patients start to recover from acute mania, the rate of lithium clearance may decrease and patients may demonstrate an increase in lithium levels and worsening side effects. This does not seem to be the case with CNN because her lithium level is within the accepted range for the management of acute mania. CNN is complaining of a hand tremor. She should be interviewed and examined to determine its origin. Lithium-induced tremor occurs in 10% to 65% of treated patients and is characteristically rapid, regular, and fine in amplitude. Often, this tremor occurs early in therapy and improves with time. Caffeine, personal or family history of tremor, alcoholism, anxiety, antidepressants, antipsychotics, and possibly older age enhance the risk of lithium-induced tremor. The tremor is more common in patients with higher serum concentrations and may be worse at times of peak lithium levels. If CNN is not bothered by the tremor and suffers no impairment, treatment is not necessary. If the tremor becomes problematic, her lithium dosage may be reduced or a beta-adrenergic blocking agent can be added. Propranolol is the most commonly used. Additionally, switching to a sustained-release lithium preparation may reduce peak serum levels and ameliorate tremors if associated with peak concentrations. Because it is early in treatment and CNN has only a moderate lithium level, it is reasonable to add propranolol 10 mg 3 times a day rather than to reduce the lithium dosage, if an intervention is required. Propranolol usually is effective at dosages less than 160 mg per day. CNN should be educated about her tremor, the adverse effects of propranolol, and instructed to minimize her caffeine consumption. In addition, CNN should be asked about her trip to the bathroom during this clinic visit, because lithium may cause both diarrhea and polyuria. Polyuria and polydipsia are common, occurring in up to 60% of patients. Nephrogenic diabetes insipidus is less common, affecting about 10% of patients on long-term treatment. Nephrogenic diabetes insipidus is dose-dependent, so CNN can be told that a lower lithium dose may minimize the symptoms. Although the advantages of once-daily administration of lithium are not universally accepted, switching a stabilized patient to this schedule with its lower trough levels may help to reduce urine volume. If CNN were to fail to respond to either of these interventions, amiloride could be administered, which minimizes lithium's effect on free water clearance. If CNN's trip to the bathroom was because of diarrhea, lithium should be evaluated as a possible cause. Up to 20% of patients started on lithium experience diarrhea, epigastric bloating, and sometimes stomach pain early in therapy. Diarrhea from lithium is associated with high serum levels, once-daily dosing, and rapidly absorbed preparations. Therefore, divided doses may help to alleviate the problem. Use of lower doses and switching to sustained-release preparations are alternative strategies that could be used if CNN is experiencing diarrhea or polyuria. Her fluid status and lithium level also should be monitored closely. Dehydration leads to increased lithium reabsorption in the proximal tubule and could result in accumulation and lithium toxicity. The next question reads, what should CNN be told regarding potential renal damage from lithium? CNN should be informed that lithium could adversely affect her kidneys. Long-term treatment has been associated with reduced kidney function and, rarely, end-stage renal disease. Routine monitoring of renal function allows for the identification of patients with precipitous declines in glomerular filtration. In such patients, lithium should be discontinued to prevent progression to end-stage renal disease. Risk factors for renal insufficiency include episodes of lithium intoxication, medical conditions that impair glomerular filtration, e.g., hypertension, diabetes mellitus, and concurrent medications that are damaging to the kidney. Communication with her physician about situations that increase the risk of lithium toxicity and cooperation with regular lithium and renal function monitoring can vastly reduce the risk of renal disease. Finally, CNN must be informed that polyuria is not related to any of the more serious renal side effects. The next question reads, what lithium education should CNN receive prior to discharge from the hospital? As with all medications, CNN should be instructed to disclose all medications she is taking to each of her healthcare providers. She should be informed that dehydration, fever, vomiting, or sodium-restricted diets could lead to increases in her lithium level. Therefore, she needs to drink plenty of fluids and should avoid restricting sodium. CNN should be instructed to contact her physician if she starts to experience any symptoms of lithium toxicity, including worsening tremor, slurred speech, muscle weakness or twitches, or difficulty walking. CNN should be told to use caution in selecting over-the-counter medications. Specifically, she should be warned to avoid the use of preparations containing non-steroidal anti-inflammatory drugs, which can increase lithium levels. CNN should know that caffeine can sometimes be troublesome in patients taking lithium, worsening tremor on a short-term basis and lowering lithium levels during the long term. With regard to serum lithium level monitoring, CNN needs to know that lithium levels usually are drawn approximately 12 hours after a dose of lithium. If she is taking lithium in the evening and the morning, she should take her evening dose and then report for a blood sample to be drawn in the morning before taking her morning dose. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom. And if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 546.